Welcome, fellow Rotarians and guests, to this important meeting on May 3rd. We will begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to now invite up Rotarian Andy Patterson to facilitate today's invocation.
Please bow with me. Dear Lord, we just thank you for this spring day and the opportunity to gather together here at Rotary. Lord, as we look at the program today, we are just so thankful for healthcare and for institutions and people that can care for our physical condition. And Lord, in a year that's been with a lot of challenges and trials, we just thank you for talented and dedicated people that are working tirelessly. We just pray for continuing wisdom for the leaders and just for refreshing for all those that have worked so hard throughout this year. In your name we pray. Amen.
Andy, thank you very much. I'd like to now ask that all of our guests today, whether you're from another Rotary Club or just happen to be a guest of a Rotarian, to please stand and be welcomed. Welcome. Thank you for joining us. Thank you. And again, today we will have 2 new member inductions. I would like to now invite up Andy Muntz, who will be introduced by Paul Hanson.
Well, my fellow Rotarians, I got to tell you, it's a privilege of mine today to introduce to you Andy Muntz. Andy Muntz is the Vice President of Operations for us here at Sanford Health. And as a Vice President of Operations, you got to be really into detail. And so when Andy, see, got to be into detail. And so when Andy approached me about being a member of Rotary, he had a well thought out plan. And of course, he gave it to me this morning and says, "Why I Want to Be in Rotary" by Andy Muntz. With plenty of tabs. So with that, I will tell you that Andy has been with us for about 17 years at Sanford Health and began his career with us as an RN and has worked his way up through various departments within our organization. The department specifically he's worked with has been cardiology, ortho. He's worked as a med-surg nurse and other places within our organization. And because of that, he offers a very unique perspective to his job and certainly his communication style. I couldn't be more proud and more honored to be able to present him to you as the newest member, or hopefully newest member, of the Rotary Club. So with that, Andy Muntz.
Thanks, Paul. We'll turn to tab 4. No, it's like our capital plan and everything else, but no, thank you. As I think about the Rotary, kind of like all things 2020, I had my first experience last fall sitting as part of a panel discussion on COVID and healthcare. And last fall, as if you remember, when our communities were surging, our healthcare facilities were surging. So had my first taste of the Rotary then. Paul has brought me to a couple other meetings here since then. And all I can say is that the luncheons have been just really, really well done, professional. The topics are really amazing, and it's really good conversation and stimulating conversation. So that's the main reason I just want to be part of this. My family's been in Sioux Falls now for 3 generations, so really deep rooted in the community and just want us to succeed. And we have all the right people and the right tools. We had orientation last week, and it's just such an impressive group when you learn about the club and everything else that as Rotarians that we stand for. So really looking forward to it, appreciate the opportunity, and thanks for the introduction, Paul.
And the next one's a fun one. I'd like to now invite up Kayla Etram, who will introduce Andrew Etram.
Good afternoon, everyone. He didn't give me a binder, but I do have some notes just to make sure that I got it all correct. I'm excited to introduce you to Andrew Eitram. He grew up in Jasper, Minnesota, and got his Master's of Architecture from North Dakota State University. He's okay after yesterday, so he'll bounce back. He's been with Architecture Incorporated for 14 years and is a principal architect and vice president. He is involved in the community. He's the vice president of the Sculpture Walk Board, coaches our son's baseball team, and another surprise is a JA classroom volunteer, so we're grateful for that. He was a previous president of Rotary South in 2014-15, so we're excited to bring him into this club. He's gotten a lot of awards and recognition, but to me, the most important thing is he's a great daddy to our two little boys. So please welcome Andrew Eitram to Downtown Rotary.
Good afternoon, everyone. Good to see some familiar faces in the room. Those that I don't recognize, I look forward to meeting you. As Kayla mentioned, I was a member of Rotary South for about 7 years. Serving as the president for a year, and so I'm very familiar with the mission of Rotary, and I'm excited to be back involved with Rotary in a club where attendance will be a little easier during the day instead of the evening. So look forward to meeting you all. Look forward to serving alongside you. Thank you.
Paul, if you don't mind, we're going to take a quick picture over here. Andy and Andrew, thank you for joining the club, and we look forward to getting to know you better in the future. All right, the program, very important program today, and I'll do a quick introduction of our panelists. Micah Aberson. Micah Aberson serves as Executive Vice President, oversees the planning, development, and execution of Sanford Health strategic marketing initiatives. Additionally, he has corporate oversight of the Sanford Health Foundation, Profile by Sanford, Sanford Research, Sanford World Clinic, and Public Policy. Micah works closely with the Sanford International Board as the organization's global footprint continues to expand through new partnerships in different countries and bold initiatives like the Sanford Lorraine Cross Award. He also serves as the chair of the Sanford International PGA Tournament Champions Board. The Sioux Falls native joined Sanford Health in 2015 as Executive Vice President of the Sanford Health Foundation, where he directed fundraising, endowment management, and special programs such as the Children's Miracle Network. Aberson is a graduate of Augustana University and earned his Master of Business Administration from the University of Sioux Falls. He and his wife, Jacqueline, have 2 daughters. Please join me in welcoming Micah Aberson. Paul Hanson, Rotarian Paul Hanson, as President and CEO of Sanford Sioux Falls. Paul leads the Sanford Health Sioux Falls market and network operations for facilities in South Dakota, Minnesota, Iowa, and Nebraska. He also works closely with enterprise resources to coordinate corporate initiatives with local operational priorities. Hanson began his career with Sanford Health at a managed facility in Watertown, South Dakota in 2000. In 2011, he coordinated Sanford Health's merger with the North County Health Services in Bemidji, Minnesota. He served as the president of Sanford Bemidji from the time of the merger through 2013 and before being named president of Sanford USD Medical Center in Sioux Falls. A graduate of Concordia College in Moorhead, Minnesota, Hanson graduated with double majors in business administration with an emphasis in hospital administration and social work with an emphasis in long-term care administration. Hanson also holds a master's degree in healthcare administration from the University of Colorado. Hanson has received the American College of Healthcare Executive Regents Award for Outstanding Healthcare Executive and is also a fellow in that organization. Hanson also currently serves on the boards of the South Dakota Association of Healthcare Organizations, the State of South Dakota Chamber of Commerce, Sioux Falls Chamber of Commerce, University of South Dakota Sanford School of Medicine, University of South Dakota Discovery District, Forward Sioux Falls Economic Development, and the Sioux Falls Downtown Rotary Club. He is also a member of a special task forces associated with local economic development and Augustana University. Hanson and his wife, Paige, have 4 children and 2 grandchildren. Please join me in welcoming Rotarian Hanson. Tony, I'll turn it over to you.
Thank you, President Jason. Welcome, fellow Rotarians, guests, and members of the media. Thank you for being here today, and thanks for those that are joining us virtually, not able to make it in person. And just a reminder, we do stream all of our programs on Facebook and YouTube, and you can find any past programs out there in our archive sites. Today, I am excited. You just heard the introductions. Paul, thanks for taking time in between all of your community efforts to be here today, and actually to be here on short notice. Bill Gasson had planned on being here, had to be called away at the 11th hour. We're grateful to have Paul here today, as well as Micah, and really to give a perspective on something that we all care deeply about, and that's our local community. And I couldn't think of a better person, the president and CEO of our Sioux Falls Market, to be here to talk about. We're going to spend a little time in the year in review, but really want to focus on where we're at now and where we're going moving forward in terms of Sanford Health. We're going to jump right in. My first question is going to be for Micah. Less than 6 months ago, we were here. Many of you were here watching online, and was up here with the leadership team talking about the merger, potential merger with Intermountain Health System. That is no longer. We know that, but I think something happened here just recently that I want you to unpack for us with your Board of Trustees making a statement at their March meeting. I'd like to have you just talk to that and why that's important, not only for your team, your employees, but also our community at large. So.
Yeah, great. Thanks for the question. Well, let me start by saying you referenced the meeting here 6 months ago. I was here for it, and it started a fairly dynamic period of time in our organization, and found us fairly busy over the course of the next few weeks post the Rotary discussion. So if the same happens this time around, I'm blaming you. I'm probably never coming back.
I'm just really glad that it was that chair and not this chair. Not that I'm superstitious or anything, but.
So it's been a dynamic several months at Sanford Health in terms of transitions that we've had, mergers that had been contemplated that are no longer being contemplated. There's a lot to unpack in all of that. Certainly more recently, and I suspect we'll get into it, we've had the yet another historic philanthropic investment from Denny Sanford. And so all of those things sort of came together within the last couple of months, and I would say it was around 6 weeks ago that our board had the opportunity to sit down, and as the dust is sort of settling between a leadership transition and their decision to push pause on the Intermountain merger, for reasons that were unique to Sanford Health. It was nothing to do with Intermountain, who we still hold in very high regard, tremendous organization who takes great care of their patients and has the same level of sort of investment in the communities that we celebrate at Sanford Health. But it was the right time for the right reasons for us to just push pause on that merger. We needed to spend some time as a team. We needed to spend time with sort of a new leadership team, certainly with Bill as our new CEO, and our board, focused on what our priorities were going to be and how we could move forward. We're still in the middle of the pandemic between Paul and his team, and then replicate that throughout the 4 major regions that we're in. We had our hands full and continue to do as we sort of emerge out of the pandemic. And so it was the right reason at the right time for us to push pause on the merger. And so then fast forward to 6 weeks or so ago, as we were preparing to make the announcement relative to Mr. Sanford's most recent gift. And the board just took sort of inventory and took stock on where things were at. And as we reflected back over the 100-year history of the organization and then thought about the 100 years that is to come in the future, the board passed a motion that Sioux Falls would remain the headquarters for Sanford Health in perpetuity. And moreover, that the CEO of the organization would be based here in Sioux Falls. I think it sends, it should send a very loud message to our communities that we intend to be a very relevant partner and a member of the communities in which we serve for the benefit of our patients who need to know that every time they come to us needing help and healing, that the organization will be here for them and that they can expect an exemplary experience when they come in to receive care and treatment. And to our employees, some 50,000 strong, to know that we are rooted and anchored in the communities that we serve, and that they will continue to come to work for Sanford Health under that name and based in the Dakotas where we're at today. And so we had a lot of great conversations, received a lot of really positive feedback from legacy board members, from philanthropists who have given of their treasure to the organization. And it's been really well received, and something that as a team and as a board we carry as a badge of pride, and something that we feel a certain duty to withhold sort of the organizational underpinnings and the things that are foundational to who Sanford Health has been and where we are today. And it also positions us really well as we, should we get into a position where we contemplate additional growth conversations, that the curb and gutter is well established, that to the extent we do contemplate an additional opportunity for organizational growth by way of another merger, that our partners know and our organization knows that the headquarters will be in South Dakota, and that our CEO will be, the CEO of the organization will be based here.
Yeah, that's a big deal. A big deal, and I know it made some press. I don't know that it got reported on is to the extent that in terms of what it means for our community and employees, that really should be upheld. Let's stay on that track. You mentioned mergers. It's not new to Sanford Health. Merit Care 2009, Good Sam here a few years ago. What does the future philosophy around strategic partnerships or mergers look like for Sanford Health?
Yeah, so I would say, I mean, the industry is experiencing a fairly unprecedented period of growth, and there's a lot of merger conversation that's happening around the country. It's no secret that Sanford historically has been a very growth-minded organization. Certainly, you heard about in Paul's 47-minute bio. I think it was like the 43rd minute you heard about his work in helping to negotiate one of those mergers. Certainly with Merit Care some 13 or 14 years ago, Good Sam just most recently. And so certainly our ability to find and achieve scale and bring efficiencies across a broad network helps us bring in additional clinical trials, helps from a patient care standpoint. There's so many good component parts to growth within healthcare. That being said, as we view potential mergers right now and growth, we view it really as a tool, not necessarily the end game. And so I would say that right now, consistent with the discussion and the agreement that we made with our Board of Trustees to really focus inwardly for a period of time, we're in a process right now of sort of looking at all of the ancillary component parts to who Sanford Health is as an organization today, through a strategic planning process to really identify who do we want to be in the next 100 years, sort of what does the next chapter of the organization look like. And so we aren't at this point actively pursuing any new growth conversations by way of some of the previous ones that you've referenced. But that being said, we're not necessarily afraid to engage the discussions as they come to us either. It's not infrequent that the phone will ring from an interested party, and for right now, again, consistent with where we're at with our Board of Trustees and our planning process, we've said, it's not the right time for us to sort of dive back into the deep end of the pool. But there's certainly going to be opportunities, we think, for sort of natural and organic growth We've recently made an announcement about moving into Williston, North Dakota, for example. So it's a community that had underserved needs, asked us if we'd be willing to come in, and it makes perfect sense. It's geographically contiguous to where we're at, and presents a great opportunity for us to better serve the patients of that community, and to be a great community partner. And so we'll continue to view growth sort of incrementally as opportunities present themselves, as a tool to make our organization better, to allow us to provide better care to patients within the communities that we might be eventually moving into, but it's not something that we're actively going and knocking on doors right now.
Yeah, thank you. I think that's a question that has come up. I know you likely get it often, but wanted to understand that as you move forward. Also want to understand, as you message that to your employees, we revert back to November when we were sitting here, and shortly thereafter with the leadership transition, it wasn't long after that the messaging from your team was all about people, patients, and community, and I believe in that order.
Mm-hmm.
Can you talk to that, the importance of that, and why that's been a constant drumbeat for you and your team?
Yeah, absolutely. And Bill Gasson gets a lot of the credit for coming out early and often. My background is in the marketing business, and I know repetition helps. People need to hear a message a number of times before it sinks in. And I think, as you mentioned, Tony, he and the leadership team made the commitment right away to say, our focus here is on our patients and residents, our people in our communities. And it's not that wasn't a focus before, and Paul can articulate this better than anyone in the corporate office, given the time that he's spending as close to our facilities and our patients as he is. There's 50,000 people that are prioritizing that work day in and day out. It wasn't necessarily the message that one would otherwise get out of the corporate office or out of the CEO's office. And so we made a very intentional shift to say that the basics, the fundamentals of who we are as an organization is first and foremost taking care of our patients and providing an exceptional experience, helping them to make sure that we're going to help them, not hurt them when they come to receive care from us. And so we need to continue to just focus our time, energy, and effort and our resources on the quality of the care that we provide, and making sure that we're providing an exceptional experience for patients. Secondary to that is the relationship that we have with our employees. They need to know that we hear them and that we're listening. They need to know that we're providing the resources necessary to take care of them when they're taking care of everybody else. It's been a dynamic and a trying time for healthcare workers across the country, and certainly our people have felt that. And so it's been extremely important to us to make sure that they know that the CEO's office and sort of the corporate leadership team is listening to them, and making sure that they've got the resources that they need. And then to our communities to know that we intend to continue to be a great community partner, a great business partner, and an organization that will continue to reinvest in the communities that we serve is really important to us.
Yeah, great, thank you. And Paul, how has that message been received by your team over the last 5-6 months?
I think anytime an organization goes through the change that we did, when you have an exec that's been in play for 20 plus years and has had a very strong vision of growth and development, and a very strong personality, very charismatic, right? We all know, that man, and Kelby did a wonderful job when he was here. And I think that, when you see, the differences and you engage or you re-engage with what is core, who are we? And I think the Board of Trustees took that step very quickly within the new administration with Bill and his team at corporate level and said, here's who we are, here's who we're going to be, here's where we are going to be, and here's how we're going to function. And I think when it starts at the top, it works its way down. And I think that when you see physicians and your staff, your leadership engage with that philosophy and know that those investments are going to be made where we're taking care of our people, where is, our core service lines, where are they? And who are we? And when you go through what we've gone through the last 18 months, that ability to reinforce, that culture of who we are back into our operations, it felt so natural for all of us. and it allowed us to be able to have some very hard conversations that need to be had. And I think we're in a better place than we were 6 months ago, obviously.
Yeah. Let's talk about that, because we are in a much different place than we were 6 months ago. Numbers in terms of the pandemic were much different October, November than they are today. That being said, we're not, we might be done with COVID, but COVID's not necessarily done with us yet. So can you talk about where we're at hospitalizations-wise in terms of the response? Been well documented on the vaccine side, but where we're at
Sure.
and kind of what you see moving forward here.
You know, it's really been interesting. You know, late last fall, we were hitting our peak with COVID, and we were seeing anywhere from 200 to 225 COVID patients in our facility, which represented just a little over half of our beds that were usable for us. If you look at our footprint, you know, we had our network facilities taking on anywhere from 50 to 100 of our patients as well. So we had all hands on deck taking care of our patients. I think that what we've seen, especially the last 3 months or so, is we've obviously seen a reduction. The numbers have come way down. As of last week, we might have had 20 COVID patients in the hospital, and of those 20, 6 might have been in ICU and 1 or 2 might have been on vents. I mean, and that's approximate, but it gives you an idea of the numbers and the volumes of what we're seeing and what we're not seeing. Now, I say that, and I will tell you that our facility is incredibly busy right now, as is, I think, you know, the other facilities within, you know, the area. And what we attribute that to is probably a backlog of those folks who did not come in to get care, you know, during, you know, this pandemic, and now we're seeing huge numbers coming back in and utilizing our services. So while we might not see a lot of pediatric patients at this point in time, we are seeing a lot of adult patients, you know, in our operations. And when you see 460 to 500 patients, you know, in your facility, and only 20 of those are COVID patients, that's the types of volumes that we're seeing right now, you know, in our organization. And so it is just as you come across or come out of the pandemic, if you will, now you're seeing the additional surge. And so our staff is really, I mean, think about the work and the effort that they're putting into taking care of our families and each other as they've come from the pandemic to now taking care of people that are in need. The other interesting thing I think that's been an eye-opener for me as a layperson is looking at what the average age of that COVID patient was just, you know, 3 to 5 months ago. You know, it was a little over 65, 66 years of age was the average. Today, those patients are under 55. So if that gives you any indication as to the power of that vaccine, you know, working, it's magic, if you will. And it's not magic, I know it's science. I'll get somebody else to correct me on that later. You know, see, that's why my introduction had to be longer. That makes you think that I'm a little smarter than I really am, you know. But I think it's just the power of the vaccine and the ability for us to be able to provide that care. And so, again, I'm incredibly proud of our staff coming off of something incredibly stressful and now getting back to business as usual. But March and April, now the first part of May, have been incredibly busy for us.
Yeah, so as you mentioned, no rest for the weary, the frontline workers, the heroes that have helped us through this. Talk to us a little bit about vaccine acceptance, not only within the community, what you've seen, but also with your teams internally. What that's looked like. It seems like we've reached a point where supply and demand has flipped.
Yeah.
But interested in your perspective.
Yeah, operationally, looking at having, you know, a little over 90% of our physicians are vaccinated. And one might say, well, why isn't it 100%? Well, we have locums that come in, we have physicians that have signed but that have not started yet. So there are some things that way that will drive that number down. But still, 90% of our physicians are vaccinated. Over 70% of our staff is vaccinated. And I think that is a significant accomplishment, especially as you look at, you know, again, some of the turnover maybe in the entry-level positions that we have and you know, getting people to understand the importance of. I was talking to my ops people earlier today as it relates to, well, what percent of our staff are vaccinated that have direct patient care? And that number is in the, you know, the mid to high 80%. So I think, you know, obviously we take care of the necessary precautions that we have when we're dealing with, you know, patient care, but those numbers are really, really high, you know, when we compare them to other institutions, at least throughout the upper Midwest. I think that what I'm hearing anecdotally is that for the most part, we try to stay out of the politics of, wearing a mask, not wearing a mask. The vaccine is, is it associated with X or X. At least the people around me that I talk to, and not that it's not 100%, but the vast majority of people there are thankful for the vaccine and what it's going to do and what it has done for us. And I can't stress that enough. And when you talk with the clinical individuals within your operations, you talk to nurses, especially nurses that have taken care of these patients, they would tell you that they want you to take the vaccine. So that's my perspective, and maybe corporately, maybe Micah could offer a different perspective.
Totally agree, and we're seeing that across our entire footprint, we've got great, efficacious vaccines from various companies, and we encourage people to get them. Paul's had his, I've had mine, and we're excited to just continue to see that roll out so that we can get back to normal.
Speaking of rollout, been some talk recently. Of course, those under 16 have not been eligible to this point. When we have a lot of parents, grandparents in our audience, when can we expect that for our kids and grandkids?
Yeah, we again just had a conversation this morning about that, and what we anticipate and what we're hearing through the grapevine is that very soon. It would be, I think, a safe bet that we could see that in the next 60 days or less. I'll be surprised if we don't, frankly, with the studies that are going on out there today. Now watch, I just jinxed it for ourselves, but I'll throw that out there. What do you hear corporately, Micah?
Well, I'm laughing because last week we issued some new guidance around masking in the workplace, and within, an hour of sending it out to everybody, the CDC came out and did a press conference. Here's the CDC's new guidance. So you almost have to knock on wood because things change so quickly. But I think it's going to be sooner than later. I think I even heard just this morning that maybe Moderna was going to petition the government for EUA authorization to move things forward more quickly, sort of within the next couple weeks for that younger audience.
Yeah, well, great. We'll stay tuned on that. And I want to go back, Paul, to something you mentioned about your team with regard to getting through the pandemic, and now they're dealing with a different surge. And I really want to focus this question on mental health. In my research for this, there's a Journal of Psychiatric Research that surveyed 571 healthcare workers, and over half, 56%, had some level of mental health ramifications because of the last year, what they went through. And what this study pointed to was problematic alcohol use, insomnia, depression. What is Sanford Health doing? We talked about the focus on the people. What is Sanford Health doing to be there for their team members through this, and community at large?
Yeah, that's a great question, and one that I think all of us as business owners, families who've had issues, with that can relate so well. We as an organization, as a corporation, we do make significant investments in a number of employee health related programs. I mean, from very specific to physician, help opportunities to our line staff to everything in between. We've made significant investments in behavioral health therapy, in service line, the behavioral health service line. I think we were talking earlier today, and I think we've actually quadrupled the amount of therapists that we have, on board in the last 12 to 18 months. And it's not because of just the pandemic. There's a significant need within the community. And I think that the training that we've offered our staff, our leadership staff, to identify, maybe areas of opportunity for us, to do an early intervention, to use technology more than we ever have in our history. Certainly many of us in this room probably have used, telehealth or Zoom, whatever else is out there, right now for meetings. But it's just more of it's accepted, and behavioral health fits into that platform so well right now for us. And I really believe that'll be an area for us, and we'll talk probably about that a little bit later, in terms of additional investments for us to really improve how we can deliver care at the most appropriate time, where people feel really comfortable about accessing that. And I think we've done a really good job internally making that available to people and having them understand. But I will also tell you that I think there's a lot of work for us to do, and there's so much more that we can do. So we're trying, we're doing our best. Are we perfect? No, but we're getting better.
Yeah. And you need employees or community members to raise their hand and step forward when those situations arise. And it seems like a large opportunity for us as a community moving forward, and appreciate your intention around the mental health of our community. I want to shift back to Micah, and this is going to focus on what you brought up earlier. From your largest philanthropist recently received a gift. I think if you'd polled this group 6 months ago, 9 months ago, that we'd be sitting here talking about a large gift from Denny Sanford. There would have been significant questions around that. Here we sit today. You mentioned the $300 million gift you announced in late March. Step us through the genesis of that, and we'll get to what that'll be invested in. But lead us up to that, securing that gift, and what that means for you.
Yeah, so it was last fall as we were sort of emerging from everything that took place by way of the leadership transition and the board's decision to suspend the conversations with Intermountain, that we had a conversation with Denny. I'll say two things. One, his commitment to the Dakotas and South Dakota in particular is absolutely unwavering. And the pride that he has for what happens here is so important to him that we continue to see him time and again make investments that make this area of the country better than it has ever been. And couple that with the pride that he has in the work that the clinicians at Sanford Health are doing day in and day out. And I would say that, the pride that he has organizationally is built on the unique 50,000 individuals who have great positive experiences with our patients every single day. And so as we worked our way through the transition in both leadership and the growth conversation, we started to have a discussion with Denny. He said, I'd really like to hear what's on your mind. I want to hear what you guys are excited about. I want to hear what is on the agenda. We spent some time with his leadership at the bank, just kicking around a couple of things that helped prepare us for having that conversation. And so we didn't go to him with necessarily new shiny bells and whistles in terms of initiatives or different things that we wanted to do. It was all based on our priorities of our patients, our people, and our communities, and what are the things that sort of align within that are on the strategic agenda for the organization. What are the things that we're anticipating over the course of the next 10 to 15 years? And so there was a small group of us that went down and met with him in Arizona. It was Bill and myself and your fellow Rotarian, our Chief Philanthropy Officer, Bobby Tibbetts, and Dr. Eric Larson, who's had a long relationship with Mr. Sanford. And we went down and we just started to talk. He greeted us at the front door and had some cookies that I don't know if he baked them or not, but there were cookies on the table. And he just said, tell me a story. I want to hear what you guys are up to. And so we started to talk about some of the sort of short-term, medium, and long-term plans of the organization. And we talked about the things that we'll get into. We talked about the virtual hospital and bringing sort of telehealth to the next level. We talked about our need to continually bring in new talent and talked about graduate medical education programs. We talked about the things that we wanted to do by way of continued community investments out at our sports complex and a couple other things. And we didn't necessarily go in with an ask, but found our way at the end of a 60-minute long conversation. And he said, well, how much is this all going to cost? We kind of looked at each other like, over the course of decades, it's not going to be inexpensive. We started doing some sort of back of napkin math, and he finished the conversation by saying, I'm in. I want to be supportive. I want to be assistive. I want to help accelerate the agenda of this team as you guys move forward, and to the extent that my philanthropy can help and be an accelerant to take what otherwise would take decades for us to accomplish and help you get that done sooner to the benefit of your patients and your people and your communities, I want to be supportive. And so we finished up the meeting. We went and had a nice dinner, and the next morning we were sort of debriefing, and Bill and I were talking and just said, was that real? I stayed in Arizona. I like to play golf, so I was staying with buddies, and they came down and joined me. So I'm on the golf course, and Bill called and he said, "Hey, are you looking at your email?" And I said, "No, Bill, I'm on the golf course." But I said, "I will right away." He said, "Well, it's real." And sure enough, we had received an email the following morning from Denny that recapped with a great degree of specificity our conversation. He included his leadership and his advisors from the bank and the bank card, and said, I want to do this. I want to be supportive." And so fast forward to 6 weeks ago or so when we made the announcement, and we made the announcement about his incredible generosity of another $300 million, taking his lifetime contributions to our organization to well in excess of $1 billion, which is unspeakably remarkable. I think that we get almost desensitized around here to the gravity of his philanthropy and what he continues to do, and thankfully Dana and Dave and Miles continue to run incredible businesses and operations that allow for his philanthropy. But the things that he's done, the impact that it has to our communities, and certainly from an organizational standpoint, what we're able to do is something that, thank you, is incredibly insufficient relative to acknowledging the level of that generosity.
Yeah, thank you for sharing that. And then let's go a step further. What does that allow you to do from a visioning perspective? Not only immediate investments that some of you've already announced, but just looking forward, what does this gift do for you at this stage in your history?
Yeah, I mean, it's huge. It accelerates what otherwise would be probably a 20-year march to something that we can start accomplishing in real time. We'll start moving dirt at the sports complex shortly. But if I take them in sort of reverse order, the things that we're contemplating by way of the virtual hospital and our ability to deliver care across a broad, rural geographic swath of the country, and bring subspecialties to communities that are losing schools and that are shrinking relative to the resources that are available to them. Our ability to deliver healthcare and bring subspecialties through the virtual hospital is going to be unprecedented, and something that we think across the country is going to be a total game changer for us. And so we're still actively having conversations in the planning process for exactly what that's going to look like, what the timeline looks like, what the appetite for some additional philanthropic investment might be. As it relates to the graduate medical education programs, it's been a long-standing hallmark of Sanford Health to sort of grow its own and to make sure that the workforce needs of the organization aren't otherwise being punted to someone else to solve for. There's a long history of investments in programs at SDSU and USD and Augustana and North Dakota State and UND, et cetera, all built around making sure that we've got the workforce that we need to take care of our patients both today and into the future. And as it relates to these 8 new graduate medical education programs that we're going to be able to stand up through Denny's philanthropy, we can do that now and quickly. So we have 2 programs that'll come online here yet this year up in North Dakota, and we'll be able to start to build those out such that we're going to have hundreds of additional physicians by the time it's fully matured that we're going to be able to train and hopefully retain right here in the Dakotas. We expect that we'll be able to keep some 35 to 40% of all the graduates of those programs. And so, again, our ability to not just hope that when somebody goes off to do a residency program at Mayo or on one of the coasts, that maybe we'll get them back to Sioux Falls, South Dakota, or Fargo, North Dakota. But we're ensuring that we're going to be able to do that, which is going to provide a great benefit to patients for generations to come. And then the sports complex is fun. It shows our continued commitment to community. It's one that without philanthropic partnership would probably have been deprioritized a little more, just given where we're at and the capital appetite that the organization has for core healthcare delivery. But Denny shares a commitment to community that we do, and it was important to him that we're able to accelerate that. And so we're going to be able to bring 365-day-a-year programming to the sports complex by adding the new soccer fields, baseball fields, softball fields out there. It's going to be all synthetic turf, so it's going to be really state-of-the-art. We already have tournament hosts from across the country that are blowing up our phones saying, hey, we want to move our tournament to Sioux Falls. When's it going to be ready? When's it going to be done? We have 4 nights a week of committed soccer leagues that already want to take full access to what's happening out there. So by way of economic development, hopefully hotel rooms that are sold when tournaments come to town, and the ability, just from a quality of life standpoint, to be able to have an asset that can be enjoyed and experienced by everyone, irregardless of one's ability to pay, but just to really have a community asset was an important step for us, and of course aligned with where Denny's head was at, so it worked out perfectly.
Yeah, great. Thank you for that update. And I have another question for Paul, but be thinking we will take a few questions from Rotarians, so if you have questions that we didn't get answered up here and would like those answered, we'll take a few at the end. We talk about economic development. Paul, you're serving in that bio that has been well documented. That Forward Sioux Falls. I don't want people to skip over Forward Sioux Falls. Can you talk about where we're at in the campaign, what that means for you personally, what that means for Sanford Health organizationally to be involved as co-chair of that effort?
Well, I look into the audience and I see Dave Rosenblum here, and I just think about what you've done and what you've been able to do, getting competitors at the table, but we weren't competitors. I mean, we're about the community. And I remember that pitch you gave me that day. I don't know if I can work with Avera, man. It was about the community. And the way that his leadership brought forth the ability for us to expand Forward Sioux Falls, to expand it from the standpoint that it can't be the way it was done in the previous years. We have to do this a little differently because it's time for us to look at who's the next generation coming up behind us, get that leadership ready to go. It's already there. They're already eager. We just have to introduce them to what Forward Sioux Falls is about and get them more involved in the ask, going back to the community leadership businesses and asking for those investment dollars. And in my mind, that's really what it is. It's an investment back in our community. And I see the success that we've had with our own philanthropic efforts. I've seen the success that the United Way has had here within Sioux Falls. And then it carries over to chamber initiatives, and it carries now over into the Forward Sioux Falls initiatives that we have. I was maybe the one that might have been a little skeptical about, is this really are we really gonna be able to achieve this, Dave? And he's like, oh yeah, Paul, you're a rookie, you've only been here for 8 years. Let me tell you about Sioux Falls. And he was right, because there haven't been, I don't think we've had any no's, in terms of the investments. We've had so many that have come back to the table and said, not only are we gonna give, but we're gonna give more than what you're asking for. I was privy to that here recently with one of our asks that we had. And we were asking for a considerable amount of money, and the business came back and said, no, we're going to give more. And to me, that's really what Sioux Falls is all about. There are times where there have been discussions about, look what happened with the interstate. Look what happened between where Sioux City was at versus Sioux Falls, just 25, 30 years ago. And then you see the impact. But the impact really came from the leadership 25 years ago, and then our generation and where we're going to go in the future. And I just see such tremendous opportunities for us when I look internally at the team that I have, and I know how much better they are than I was at that age and at that level where I was at with my experiences. My team is far superior than where I was at their age and their level of experience. And so for me, applying that to the rest of the community and see where we're at, I think, Dave, we had a cash goal of close to $15 million with Forward Sioux Falls. I think we're getting very near that, and if not already at that, based upon a couple other conversations that we're going to have. But that is significant when you think about the impact that will have on our community for the next 5 years. And nobody can touch that within this state. And certainly there's a state north of us. I'm not really sure what it's called. It escapes me right now. It's north of us. We have some friendly competition going back and forth. Well, it's not so friendly. But it is fun to be able to benchmark, not only our operations, but our community's operations, our community chamber, our state against those other benchmarks. And I'm incredibly proud of where we're at. And Dave, what you were able to do, because you really deserve the credit in terms of that. You organized it, you coordinated it, you got the people there. I'm not looking for a job, but just in case.
You might be if you keep going.
Well, yeah, I'm done. You have to be there. You have to be there to experience it, because when you look at these numbers, you're going, there's no way. And okay, I'm in. And then it happens, and it's just incredible.
Yeah, well, thank you for your leadership in that endeavor, and both of you, your leadership, and you guys heard it here. Sanford Health is here to stay with Sioux Falls as its headquarters, and the CEO will be located here. Big deal for us. Forward Sioux Falls is a big deal. Most recent gift is a big deal, and just excited. I think it speaks to the collaboration that you mentioned, and the reason that Dave wanted both healthcare organizations. It's been quite a year for healthcare organizations, and to have you and Mr. Fleechek co-chair is awfully symbolic of what's made Sioux Falls special for so long. So with that, we're going to take a few questions.
Steve Sikorsky, can I ask about the medical school, which I think right now is limited to 72 or 73 students per year? Is that totally up to the legislature on how many new students come in at the white coat ceremony every summer? And it seems like we need more physicians in South Dakota and Sioux Falls, and we're knocking on the door of 200,000 people here. And do you have the facilities, and do you have the instructors, and can you just give us a little of your perspective on that?
Yeah, great question, Steve. I don't have the answer for the first part of your question in terms of how do we get more in, in terms of the funding for that and for the medical school. But I will tell you that we are working incredibly closely with our medical school to develop some of the fellowship and the residency programs we talked about with the GME discussion here earlier. Because it doesn't just happen. It takes a couple of years for that to really get up and running. The other thing is that with the relationship with the USD on the aligned services, we've had a lot of discussion about potentially can we develop a CRNA program at a state school, USD as an example. We'll see where that goes, but we've had a lot of interest from the universities to develop healthcare service programs up into, including getting into the the medical school, how do we expand that down into, the other aligned services. So I will tell you that every major university that we have within this state has contacted my office asking how can we align closer with, Sanford Health. Those conversations happen on a regular basis. And it's just a matter of, what can we fund? How do we fund it? Where's the best, use of those dollars? Obviously the universities there's some competing programs, so they've got to work out their details with that as well too. We're just here to figure out a way to provide good people back to our operations, and how do we invest maybe in our existing people and put them through programs. And that's the big thing we're looking at for some career laddering right now today.
Thank you, Steve. Any other questions?
Thank you for all your updates this morning. I'm Joel Dykstra, Downtown Rotary. I just wondered, my wife tells me this morning that I signed up again to volunteer at the golf tournament this year, and I just wondered if there was any life left in that candle, or has that ship sailed? What's the future of the Sanford International?
Yeah, good question, Joel. Thanks for volunteering, by the way. There's life left in the conversation. We take a lot of pride in the tournament, the Sanford International. It's been great for the community, in excess of $20 million in direct revenues that come in. We've got 1,000 volunteers. The number of eyeballs that it captures across the country and across the world through the Golf Channel coverage puts a great spotlight on this community. We have been engaged in ongoing conversations with the leadership at Minnehaha Country Club. There's a member town hall yet in the month of May to sort of reapproach the conversation. You know, it's for the members. It's an ask of them. I mean, they have to give their club up for 8 days, and then there's disruption through the build out process and that sort of thing. And so, we've tried to come up with as many creative solutions as possible to accommodate the construction timeline and do things that hopefully reduce the level of distraction for the members, and hopefully the plans that we've put in place will be met favorably as we get back together with that group and they make some subsequent decisions as a membership. So it's our hope and intent that we can continue to pursue the conversation. Of course, we still have 2 years left on our current contract. So at a minimum, we'll have champions of the Sanford International in the next 2 years.
Time for one more. If not, I want to thank Micah and Paul for being here today and taking questions, and then just being open with us with regard to where you've been and where you're headed. I do want to invite you back next week. We'll have David Herbster from the University of South Dakota and Justin Sell from South Dakota State University to talk about athletics. If you've been following, there's a lot of conversation on the transfer portal. There's also a lot of conversation around name, image, and likeness, and pay for play. Those dynamics are changing things pretty quickly for athletes and for colleges that are working through this. So please join us for that conversation next week. We look forward to seeing you then. I'll ask Jason to come back up and close us out.
Round of applause for Micah, Aberson, and Paul Hanson. Tony, you used the phrase big deal to describe a lot of the conversation points that happened today, and everything about this conversation was a big deal. So thanks again, Micah and Paul, for being here with us. Please join us again next week. Another important conversation and more to come as we work through the months of May and June. So with that, this meeting is adjourned. Thank you.